Good evening. I stand before you today to discuss something that should deeply trouble us all. For the first time in 25 years, for the first time this entire century, we are witnessing an increase in child mortality rates worldwide. This isn't a natural disaster. This isn't an unexpected pandemic. This is a crisis entirely of our own making, driven by decisions made in capitals across the developed world to slash foreign aid budgets. Let me give you the stark numbers. In 2024, 4.6 million children died before reaching their 5th birthday. This year, projections from the Institute for Health Metrics and Evaluation indicate that number will rise to 4.8 million. That's 200,000 additional preventable deaths. 200,000 children who will never learn to write their name, never tie their shoes, never celebrate their 6th birthday. As Bill Gates has noted, kids' deaths are often even greater than adult deaths in these situations, and the burden falls disproportionately on the world's poorest communities. Now, I want you to understand what we're talking about when we say 200,000 children. Picture more than 5,000 full classrooms of children gone. Imagine every kindergarten in several medium-sized countries simply disappearing. That's the scale of what's happening this year alone. And this is just the beginning if we continue on our current path. The primary driver of this crisis is brutally simple. Global development assistance for health has plummeted by nearly 27% this year compared to 2024 levels. In concrete terms, health aid dropped from approximately $49 billion in 2024 to $36 billion in 2025. That $13 billion gap translates directly into lives lost. The United States, historically the world's largest contributor to global health programs, has led these cuts. The dismantling of USAID, dramatic reductions in funding to organizations like Gavi, the International Vaccine Alliance, and proposals to shut down the CDC's Global Health Unit have sent shockwaves through the international health community. But America isn't alone in this retreat. The United Kingdom, France, Germany, Norway, all have significantly reduced their commitments to global health. Even as the world has grown wealthier, we are collectively choosing to spend less on protecting the world's most vulnerable children. Let me be clear about what these cuts mean in practice. They mean children dying of pneumonia, a disease we can treat for pennies. They mean children succumbing to diarrheal diseases when simple rehydration solutions could save them. They mean children dying of malaria when insecticide-treated mosquito nets and effective treatments exist. They mean children never receiving vaccines against measles, polio, and other preventable diseases because the cold chain systems that deliver those vaccines have broken down. The countries most dependent on foreign aid are seeing the worst impacts. We're talking about nations in sub-Saharan Africa, parts of South Asia, regions where health systems were already fragile and are now buckling under the weight of these funding cuts. These are places where a doctor might serve 50,000 people, where a single health clinic covers an area the size of a small European country, where mothers walk hours to reach basic medical care. When funding disappears, these systems don't just weaken, they collapse. Now, let's look at the predictive modeling, because the future scenarios are even more sobering. If global health funding cuts of 20% persist over the next 2 decades, researchers project an additional 12 million child deaths by 2045, compared to a scenario where aid remains stable at 2024 levels. 12 million children. That's roughly the entire population of Belgium, gone. If the cuts deepen to 30%, a scenario that unfortunately seems increasingly plausible given current trends, we're looking at 16 million additional child deaths by 2045. 16 million mothers experiencing a loss that no parent should ever have to endure. 16 million futures erased. 16 million contributions to humanity that will never be realized. Let's discuss the specific mechanisms through which these deaths will occur. First, immunization coverage will decline. Gavi, which has helped vaccinate over 1 billion children since its founding, has seen major donors cut or pause funding. The United States alone has provided $8 billion to Gavi since 2001, and those funds are now in question. When vaccination coverage drops, diseases that were nearly eradicated come roaring back. We've already seen measles outbreaks killing over 100,000 children in 2023. Without sustained vaccination programs, polio could return to countries that had eliminated it. Diphtheria, whooping cough, tetanus, all could make deadly comebacks.
Second, primary healthcare systems will deteriorate. Much of the foreign aid doesn't go to high-tech interventions. It goes to the basics, training community health workers, maintaining supply chains for essential medicines, ensuring that health clinics have electricity and clean water. When this funding disappears, the entire foundation of healthcare in low-income countries crumbles. Pregnant women stop receiving prenatal care. Malnourished children don't get supplementary feeding. Families can't access treatment for common infections. The compounding effect of these system failures is catastrophic. Third, progress against major killers will stall or reverse. Pneumonia, the leading infectious cause of death in children globally, requires both prevention through vaccines and treatment through antibiotics. Both require functioning health systems. Diarrheal diseases, which kill hundreds of thousands of children annually, require access to clean water, sanitation, and oral rehydration solutions. All of these interventions depend on sustained funding. Malaria programs need continuous investment in mosquito nets, indoor spraying, diagnostic tests, and artemisinin-based treatments. Interrupt that funding, and gains made over decades vanish in months. Let me address a crucial point. Some may argue that wealthy nations face their own budget pressures, that tough choices must be made. But consider this. For rich countries, foreign aid for health represents less than 1% of their national budgets. Less than 1%. We're not talking about choosing between domestic health care and foreign aid. We're talking about spending levels so small they barely register in national accounts, yet they mean the difference between life and death for millions of children. The return on investment in global health is extraordinary. Every dollar spent on childhood vaccines returns approximately $44 in economic benefits. Every dollar invested in combating malaria generates about $40 in economic returns. These aren't just moral investments, they're spectacularly effective economic investments. Countries with healthier children see stronger economic growth, better educational outcomes, and more stable societies. Moreover, global health security is interconnected. Diseases don't respect borders. The same health systems that protect children from pneumonia and measles also serve as early warning systems for pandemic threats. The same networks that deliver vaccines also monitor for emerging infectious diseases. When we defund these systems, we're not just harming distant populations, we're undermining our own security. The next pandemic will find us even less prepared than we were for COVID-19. Let's talk about what could happen instead. The medical innovations in development right now are breathtaking. There's lenacapavir, a twice-yearly injection that could virtually eliminate HIV transmission. New maternal vaccines could prevent respiratory syncytial virus, or RSV, in millions of babies before they're even born. Next-generation malaria vaccines and treatments could finally bring this ancient killer under control. Novel pneumonia interventions could save countless children from the world's leading infectious killer. Here's the remarkable thing. If we maintained 2024 funding levels and supported the rollout of these innovations, researchers estimate we could save 12 million additional children by 2045 compared to current trajectories. Think about that. The difference between the worst-case scenario of 16 million additional deaths and the best-case scenario of 12 million lives saved is 28 million children. 28 million futures hanging in the balance, determined entirely by our funding decisions. Several specific policy outcomes are likely based on current trajectories. First, we'll see increased child mortality concentrated in the poorest countries, widening global health inequities. Countries like Nigeria, the Democratic Republic of Congo, Ethiopia, and Pakistan will bear a disproportionate burden. This will likely fuel migration pressures, political instability, and conflict as communities struggle with compounding crises. Second, progress toward eliminating diseases like polio and guinea worm will stall. We're on the verge of eradicating these diseases entirely. But you can't almost eradicate a disease, you need to finish the job. If we pull back now, these diseases will reestablish themselves and will have wasted decades of effort and billions of dollars of previous investment. Third, antimicrobial resistance will accelerate. When health systems are underfunded, people can't access proper treatment. They use substandard or counterfeit drugs, incomplete treatment courses, and inappropriate antibiotics. This creates perfect conditions for resistant bacteria to emerge and spread. We're already facing a post-antibiotic future in some respects. Defunding global health will accelerate this catastrophe. Fourth, we'll see knock-on effects on other development goals. Children who survive but suffer from malnutrition and repeated infections have stunted growth, both physical and cognitive. They perform worse in school, earn less as adults, and are more likely to remain trapped in poverty. By allowing child mortality to rise, we're condemning entire future generations to diminished potential. There are different pathways forward from this crisis point. In the most optimistic scenario, there's a reversal of current trends. Public pressure, advocacy from organizations like the Gates Foundation, and emerging evidence of rising child mortality could prompt governments to restore funding. New donors could emerge. Countries like Indonesia and South Africa are already increasing their contributions. Perhaps others will follow. China, for instance, could significantly increase its role in global health. Middle-income countries could take on greater responsibilities. In a moderate scenario, funding stabilizes at current reduced levels but doesn't fall further. In this case, the international health community would need to achieve remarkable efficiencies. Some countries are already showing what's possible. In Nigeria, the governor of Gombe State prioritized primary health despite historic budget deficits, demonstrating that strong political will can maintain progress even with limited resources. Community health workers in places like Kenya continue their work unpaid, driven by commitment to their communities. These examples of resilience are inspiring but can't substitute for adequate funding. In the pessimistic scenario, cuts deepen. Political trends in wealthy nations continue moving away from internationalism and toward insularity. Domestic political pressures, rising defense spending, and economic challenges lead to further reductions in foreign aid. In this scenario, we could see catastrophic reversals in global health, with child mortality returning to levels not seen since the 1990s. The geopolitical implications of these scenarios are significant. Rising child mortality in developing nations will strain governance and fuel instability. Countries struggling with health crises are more vulnerable to extremism, conflict, and state failure. This creates security challenges that will eventually require Western intervention, likely at far greater cost than the aid we're cutting now. We're choosing expensive military interventions over cheap preventive healthcare, which is both morally questionable and strategically foolish. There's also a question of global leadership and moral standing. For decades, the United States and European nations position themselves as champions of human rights and development. Slashing aid to dying children while maintaining massive defense budgets and allowing billionaires to accumulate unprecedented wealth sends a clear message about our priorities. This damages soft power and undermines our credibility in international forums. Let me address some likely counterarguments. Some will say that aid creates dependency, that countries need to be self-reliant. But we're not talking about indefinite dependency. We're talking about supporting countries through development transitions. South Korea, Singapore, and Taiwan all received substantial foreign aid during their development. Now they're donor nations themselves. That's the goal, to help countries reach a level of development where they can fully fund their own health systems. But you can't reach that point if your children keep dying of preventable diseases. Others will argue that aid is ineffective, that it's wasted through corruption or poorly designed programs. There are certainly examples of poorly implemented aid. But the overall evidence is overwhelming. Foreign aid has contributed to massive reductions in child mortality, dramatic increases in vaccination coverage, and near elimination of diseases like polio and guinea worm. Organizations like Gavi and the Global Fund have strong accountability mechanisms and proven track records. The idea that all aid is wasted is simply not supported by evidence. Some will suggest that private philanthropy can fill the gap. The Gates Foundation and other philanthropic organizations do incredible work, but they can't substitute for government funding. The Gates Foundation's entire endowment is around $100 billion. That sounds like a lot, but global health aid from governments was $49 billion in just 2024 alone. Even if the foundation spent down its entire endowment immediately, which would eliminate its ability to fund anything in future years, it wouldn't cover 2 years of the current funding gap. As we look ahead, several key decision points will determine which scenario unfolds. The first is whether the United States restores funding to organizations like Gavi and maintains USAID programs. American leadership in global health has been transformative. A recommitment from Washington would signal to other donors that this remains a priority. The second decision point is whether European nations reverse their cuts. France, Germany, and the UK have all scaled back aid, but their budget processes are ongoing. Public pressure and advocacy could still change outcomes, especially in parliamentary democracies where legislators respond to constituent concerns. The third factor is whether emerging economies step up. Countries like China, India, Brazil, and the Gulf states have growing capacity to contribute. If they increase their role, they could partially offset cuts from traditional donors while also gaining influence in global health governance. The fourth factor is innovation and efficiency. New technologies and approaches could help stretch limited resources. Digital health tools, more efficient supply chains, and community-based delivery models could help health systems do more with less. But there are limits to efficiency. You can't replace adequate funding entirely through innovation. Let me paint 2 pictures of what 2045 could look like. In the first scenario, we chose the path of disinvestment. Child mortality has risen steadily for 2 decades. 16 million additional children have died. Diseases like polio have resurged. Measles outbreaks occur regularly. Malaria has made a comeback in regions where it had been nearly eliminated. Low-income countries face economic stagnation because their populations are sicker, less educated, and less productive. Regional instability has increased, leading to conflicts and displacement. The wealthy nations that cut aid face refugee crises, security threats, and moral reckoning with their choices. In the second scenario, we chose differently. Funding was restored and then increased as innovations were deployed. Those 12 million children who would have died are alive. Polio is eradicated. Malaria is on the verge of elimination. New vaccines and treatments have transformed the landscape of childhood disease. Countries that were aid recipients have become partners and then donors. Global health security is stronger. Wealthy nations maintain their moral authority and their commitment to human dignity. These aren't abstract scenarios. They're choices. The question is which future we want to live in and which legacy we want to leave. Now, let's discuss what needs to happen immediately. First, we need urgent advocacy to restore funding. This means public pressure on legislators in wealthy nations. It means making child mortality a political issue that voters care about. It means highlighting the stark choice between spending less than 1% of national budgets on global health or accepting that millions of children will die preventable deaths. Second, we need to defend and strengthen the institutions that deliver global health. Gavi, the Global Fund, USAID, the WHO, these organizations aren't perfect, but they're proven lifesavers. They need protected funding, multi-year commitments, and support for their work. Third, we need to prioritize the most cost-effective interventions. In a resource-constrained environment, every dollar must count. Vaccines, mosquito nets, oral rehydration solutions, antibiotics for pneumonia, these basics save more lives per dollar spent than almost any other intervention. We should fully fund these before moving to more expensive approaches. Fourth, we need to support health system strengthening. It's not enough to deliver individual interventions. Countries need functioning health systems with trained workers, reliable supply chains, and adequate infrastructure. This requires sustained investment, not project-by-project funding. Fifth, we need to prepare for and deploy new innovations. The new RSV and malaria vaccines, lenacapavir for HIV prevention, improved diagnostic tools, all of these need to reach the children who need them. That requires funding for research, for regulatory processes, for manufacturing scale-up, and for delivery systems. Let me address directly the moral dimension of this crisis. We live in the wealthiest moment in human history. Global GDP exceeds $100 trillion. The collective wealth of billionaires is measured in trillions. Technology has given us capabilities our ancestors couldn't imagine. We have the knowledge and the means to prevent virtually every child death we're discussing today. The only thing lacking is political will. When we choose not to fund these programs, when we decide that less than 1% of our budget is too much to spend on saving children's lives, we are making a moral choice. We're saying that these children's lives aren't worth that investment. We're saying that we'd rather have slightly lower taxes or slightly higher defense spending than prevent 200,000 deaths this year and millions more in coming decades. History will judge us by this choice. Future generations will look back at this moment and ask why, in the midst of abundance, we allowed children to die of diseases we could easily prevent. They'll want to know what we were thinking, what our priorities were, why we valued other things more than children's lives. Some will argue this is emotional manipulation, that policies should be based on cold calculation of national interest rather than sentiment about distant children. But even the coldest calculation supports global health investment. The return on investment is extraordinary. The security benefits are substantial. The economic advantages are clear. And morality aside, there's a basic question of whether we want to live in a world where we could save millions of children but choose not to. As I conclude, I want to emphasize that none of this is inevitable. The projections I've shared are based on current trends, but trends can change. Political decisions can be reversed. Funding can be restored. The 200,000 additional deaths projected for this year could still be prevented if we act now. The millions projected for coming decades are not a fixed fate. What's required is leadership. We need political leaders in wealthy nations to stand up and say that global health funding is non-negotiable, that we won't balance budgets on the backs of dying children. We need civil society organizations to mobilize public opinion, to make this a political priority that can't be ignored. We need the media to cover this crisis with the urgency it deserves, to put faces and stories to the statistics. We need each of us to recognize that we have power and responsibility. Contact your elected representatives. Make clear that you care about this issue and that you'll remember their choices at the ballot box. Support organizations working in global health. Share information about this crisis with your networks. Push back when people suggest that foreign aid is wasted or that we can't afford it. Help change the narrative. This is a test of our civilization. Will we use our unprecedented wealth and capabilities to protect the most vulnerable? Or will we hoard our resources while children die of preventable diseases? The answer to that question will define who we are as a global community and what values we truly hold. The children dying this year and in coming years won't know why we failed them. They won't understand the budget politics or the ideological debates. They'll just be gone. But we'll know. We'll live with the knowledge of what we could have prevented, but chose not to. That's the legacy we're building right now with every funding cut, with every program elimination, with every decision to prioritize other concerns over children's lives. I believe we can do better. I believe that when confronted with the reality of what our choices mean, people of conscience will demand change. I believe that the arc of history, though it bends slowly, bends toward justice and compassion. But belief isn't enough. We need action. We need it now. We need it from governments and organizations and each individual person who hears this message and decides that this matters, that children's lives matter, that we can and must do better. The choice is ours. The time is now. The children are waiting. Thank you.